Merci beaucoup, Monsieur le Président. Je prends la parole du projet de loi C-37. I rise today, Mr. Speaker, in support of Bill C-37, an act to amend the Controlled Drugs and Substances Act and to make related amendments to other acts, which contains essential amendments to address the current opioid crisis as well as problematic substance use more generally. La toxicomanie et la dépendance posent d'importants risques aux personnes, aux familles et aux collectivités, Monsieur le Président. Notre gouvernement est résolu à s'attaquer à cet enjeu complexe lié à la santé publique en adaptant une approche qui protège la santé publique et qui maintient la sécurité publique à l'aide d'une politique sur les drogues qui est exhaustif et axée sur la collaboration, la compassion et la donnée probante. Problematic substance use, Mr. Speaker, and addiction pose significant risks for individuals, families, and indeed communities. Our government is committed to addressing this complex public health issue using an approach that protects public health and maintains public safety through drug policy that is comprehensive, collaborative, compassionate, and most importantly, evidence-based. A comprehensive public health approach to this crisis must include harm reduction alongside prevention, treatment, and enforcement. Harm reduction recognizes that not all individuals are ready, willing, or able to seek treatment for drug addiction. Those who are outside of the treatment system, for whatever reason, Mr. Speaker, deserve to be treated with dignity and respect. Just like every other Canadian, their lives are valuable and they're worth saving. Supervised consumption sites and other evidence-based harm reduction measures provide services to active drug users to help improve their health and prevent harms, including death. And I know that some members in this House talk about supervised consumption sites as controversial, Mr. Speaker, and that they have well-grounded concerns about this portion of Bill C-37. But today I want to address these concerns by discussing the evidence on supervised consumption sites. This evidence is available in peer-reviewed journals, including some of the most esteemed medical journals around the world. We're living in a time where opinions can somehow become facts simply by stating them in a public forum. And this concerns me, and it should concern everyone in this House, Mr. Speaker. As Canadians, we're lucky to have the most well-researched, supervised consumption site in our own backyard, Insight. While supervised consumption sites have existed in Europe since the 1980s, the studies done on Insight produce specific, measurable evidence of the impact of this supervised consumption site on drug users and on the surrounding community. Insight began as a pilot project, Mr. Speaker, and was the focus of a significant scientific evaluation. Over 30 peer-reviewed journal articles came out of this evaluation, all of which demonstrated that Insight was achieving its objectives without having a negative impact on the surrounding community. I won't stand here, Mr. Speaker, and list off each of these studies, but I will mention a few. For example, a 2004 study, Mr. Speaker, published in the Canadian Medical Association Journal, found that in the 12 weeks after Insight opened, the number of drug users injecting in public and the number of publicly discarded syringes and injection-related litter were reduced as a direct result of Insight being there. Further, Mr. Speaker, a 2006 study published in the New England Journal of Medicine found that at least weekly use of Insight and any contact with the facility's addictions counselors were both independently associated with people entering a detoxification program more quickly. Finally, Mr. Speaker, given the opioid crisis that we are currently facing, I want to highlight a 2011 study published in The Lancet that found that fatal overdose rates in the area around Insight decreased by 35%, Mr. Speaker, after the opening of the site. This is compared to a decrease of only 9.3% in the rest of the city during the same time period. Furthermore, Mr. Speaker, the European Monitoring Centre for Drugs and Drug Addiction indicates that the common concerns regarding supervised consumption sites, such as increases in crime and drug use, are simply not grounded in evidence. It is clear from the research that supervised consumption sites can play an important role in a community's response to problematic drug use. But this does not mean that supervised consumption sites should be opened without taking into account the needs of a community and public health and safety considerations through a thorough review of an application. Rather, Mr. Speaker, it means that the application process should start from a place that acknowledges the evidence Sites need to be properly established, considering the need for a site, community concerns, and local conditions that may influence the effectiveness of the site. And they must be properly maintained to ensure clients continue to receive proper care and communities continue to have confidence in the service that's being provided. And it is understandable, Mr. Speaker, that Canadians may have questions and concerns regarding the establishment of such a site in their community. These sites are still relatively novel, Mr. Speaker, in North America, and that's why consultation with the community plays an integral role in the success of a site. The Supreme Court clearly recognized the importance of consulting with community members when establishing such facilities, and included community support or opposition as one of the 5 key factors the Minister of Health must consider when assessing any application. Je veux toutefois préciser une chose, Monsieur le Président. Les consultations ne sont qu'une partie du processus de demande. Le gouvernement est résolu à prendre ses décisions en fonction des données probantes. Et cela veut dire qu'il faut aller au-delà des débats idéologiques qui sont courants pendant les discussions sur la toxicomanie pour tenir compte de tous les renseignements pertinents et prendre des décisions éclairées et fondées sur les données probantes, Monsieur le Président. Voilà pourquoi le projet de loi C-37 propose de remplacer les 26 critères qui sont actuellement prévus dans la loi par 5 facteurs décrits par la Cour suprême du Canada dans son arrêt Canada, procureur général, contre PHS Community Services Society de 2011. Reducing the number of criteria applicants would have to address would relieve the administrative burden on communities seeking to establish a supervised consumption site, Mr. Speaker, but it would also do so without compromising the health and safety of those operating the site, its clients, or the surrounding community. Removing the application criteria from legislation allows the government to maintain a thorough, evidence-based application process that can be adapted and updated over time to reflect emerging science. At the same time, it would also keep communities at the heart of applications and allow applicants to respond more quickly to emerging health issues. For example, there would no longer be a requirement for applicants to submit evidence that supervised consumption sites are effective and have public health benefits. And as I noted earlier, Mr. Speaker, the evidence in this regard is clear. Instead, applicants would need to demonstrate the need for the site and the public health benefits of the proposed site for the local community. This change will help ensure that applicants consider their local context, including the needs of their community, when designing their proposed site. Now, this government, Mr. Speaker, is committed to making objective, transparent, and evidence-based decisions. With respect to supervised consumption sites, the evidence is clear. Properly established and maintained sites can save lives, Mr. Speaker, without having a negative impact on the surrounding community. And I urge all members to support Bill C-37 so that we can move forward in addressing the opioid crisis through a comprehensive response that includes evidence-based harm reduction measures that help save lives. Merci beaucoup, Monsieur le Président. Thank you very much.